Hello, I'm Dr. Douglas Denham. I'm a family practice physician here in San Antonio, Texas. I've been practicing for 22 years here in San Antonio. I'm also medical director at Clinical Trials of Texas, where we do a lot of different types of research, but predominantly diabetes. I'm here today to talk with you about diabetes here in America. This is a medical epidemic that's not only affecting America, but it also affects the world. Just some quick statistics to let you know, there are about 30 million children and adults in the United States today who have diabetes. Of these 30 million, 21 million of them are actually diagnosed with diabetes, and there's about 8 million that are running around that currently have elevated blood sugars but are not diagnosed with diabetes. And then there's about another 86 million folks running around America that are what we would call pre-diabetics, meaning they haven't quite reached the criteria where we define them with diabetes, but they're actually not handling their blood sugars very well, and they're on a slow but steady decline to where they become diabetics. And then just so you're aware, about 2 million new cases of diabetes are diagnosed every year here in America. So let's talk a little bit about what is diabetes. It's a metabolic disorder in which the body's not able to control and maintain sugar or glucose control in the body. This occurs for a number of reasons. It's related to obesity here in America and around the world. It's related to decreased pancreatic function, beta cell decline and destruction and damage, which can be due to a number of issues. I think classically we talk about diabetes in two forms, type 1 and type 2. We consider type 1 as what we used to call juvenile diabetes. And what this is a diabetes that's usually an autoimmune cause, where suddenly the person is no longer able to maintain their blood sugars due to damage to the beta cells, and they're not able to produce insulin, or the insulin that they produce is no longer functional, and therefore they need additional or exogenous insulin given to them to control their blood sugars. This only makes up about 5% of the general population of diabetes. So the bulk of it is what we call type 2. These are folks who may have a family history or just through time because of obesity and gradual decline of the beta cell function are unable to control their diabetes. We classically think of this as related to obesity, and it affects all segments of the population, all races, pretty much equally distributed, male and female, and then again through all the races, although Native Americans, a little higher incidence in our Hispanic and Black populations does tend to occur. So let's talk about what is the presentation of diabetes. Classically, people will come in complaining of increased thirst. They're always thirsty. They're going to the bathroom a lot of frequent urination, trouble that way. This may get them in trouble with their jobs if they have a sedentary job where they have to be at their desk and can't get up and go to the bathroom regularly. The other thing is what people will call, or what we call polyphagia, which means they're always hungry. So it's a triad of symptoms that together will point to your doctor suggesting that we check you for diabetes. Again, it travels in families, so it's very common for parents, grandparents, sisters, brothers to have this. It is a treatable condition. We have multiple medications that we use for this, and we'll talk about those in a little bit later on. So you're sitting there thinking, maybe I have some of these symptoms, and what should I do about that? I would call your doctor and go in and get tested. We also do some tests here at Clinical Trials of Texas, where you can come in and have a free diabetes screening, in which we'll check a hemoglobin A1C, which will help us that way. But what your doctor's going to do is have you come in, do a complete history on you. He'll do a physical exam on you, looking for any telltale signs of diabetes. Some of those can be a dark rash on the back of your neck. Again, generally related to obesity, so folks with type 2 diabetes will be in the upper BMIs greater than 25, probably more likely to be in the 30 to 35 range. They can do a fasting blood sugar, in which you come in without eating anything from the night before. Any fasting blood sugar greater than 126 is an indication and diagnostic of type 2 diabetes. We could also do a random blood sugar if you have an afternoon appointment and you haven't eaten fairly recently. Anything greater than 200 would be suggestive of diabetes, although I would recommend getting a fasting sugar at that time. And then hemoglobin A1C is another test that we can use to pretty reliably diagnose folks with diabetes. And what that tests is the amount of sugar that's attached to your red blood cells. We know the red blood cells last about 60 to 90 days, so it gives us a good measure of what your average blood sugar has been. And anyone with a A1C of 6.5 or greater should be further tested and evaluated for having type 2 diabetes. So once you're diagnosed, how would we treat this? Well, the mainstay of treatment for diabetes, type 2, as well as type 1 in a lot of cases, is going to be diet, making sure that you're eating the right types of foods and the right quantities of foods. It's also going to be exercise and weight loss, which are key to reducing the weight, which leads to diabetes. Medication-wise, we have many medications. We have oral medications, some very old, metformin, the sulfonylureas are another older class of drug which help us bring your blood sugars down. Some of the newer medications you may be hearing about are the SGLT2s and the GLP-1s, which are newer medications designed to also help bring your blood sugars down. And then we have Lantus or Detamir, the insulins, the long-acting and the short-acting Humalog and Novolin, which are then given through shot form. Or if you have severe diabetes and can't get under control, your endocrinologist or internist or family practice doc may suggest sending you to get a pump, which gives you a continuous supply of insulin. It's also another excellent way of bringing people under control. I think in America, people are a little leery of insulin. There's the feeling that by the time I'm on insulin, I'm in pretty severe shape. And I would say that's not the case. We traditionally have kind of held back on insulin, probably more for cost reasons than actual severity of your illness, just because people don't want to give themselves shots. But the newer pens and the ultrafine needles and things like that, they allow us to give insulin with minimal or no pain. And it's a very good way of getting someone under control very rapidly. And then if you're a type 2 diabetic, you can sometimes wean someone off the insulin once you've gotten them controlled and put them back on an oral medication, again stressing diet and exercise and those kinds of things, and they can control their blood sugars fairly well for some periods of time. So we talked about the 86 million people that are pre-diabetic. And pre-diabetes is a condition where your body is not controlling your sugars as well as we would like it, but you haven't reached those criteria that have been established by the endocrinology societies to say that you actually have diabetes. But I would say this: once you're on that track, you eventually will develop diabetes, and so finding out early is a great way to stop the progression and get you on a program that we can maybe prevent you from becoming overtly diabetic, but certainly can prolong the time before you will eventually become diabetic. So pre-diabetes, our treatment plan is going to be a little bit more aggressively on the diet, exercise, and weight loss side. Some physicians will start folks on metformin, which is an excellent drug and a well-known drug to us as physicians that helps us get your blood sugars down and keeps them below those values that we talked about. But I think the big success is going to be on changing your lifestyle and starting to learn to do those good things that we want you to do and get away from the bad habits, either eating and non-exercising and those kinds of things. Unfortunately, like we talked about before, if you have a family history of it, there's nothing we can do about that at this time, but we can keep you from becoming a diabetic for a period of time. And some people do a very good job of controlling their diabetes and pre-diabetes just with exercise and diet alone. When we think about treatments for diabetes, I think most people don't realize that the treatments that we have currently all have been tested in clinical trials around the world many, many years prior to them becoming available. And that's what we do here at Clinical Trials of Texas. We participate with both pharmaceutical companies and other small biotech firms for devices, pumps, blood glucose meters, those kinds of things to test and bring new products to the market. and it's exciting. It's exciting part of medicine that I've enjoyed for the last 10 years. Um, if you are diabetic or you think maybe that you have diabetes, we welcome you to call us here at Clinical Trials of Texas. We can set you up for a pre-screen where we would bring you in. We'll do a finger stick A1C, which doesn't hurt at all. That'll give us a good idea where your blood sugars are. If you're not diabetic or not in that pre-diabetes area, that's great for you. If you are, we can also talk with you about maintaining and treating your diabetes, refer you to your diabetic, or if you're already a dietitian or diabetic, we can get you in here and maybe participate in a trial to help us find a treatment or even a possible cure for diabetes. So do we have a question and answer kind of thing, portal set up for this? Okay, all right. So we can talk a little bit more about some of the medications in more in depth. I mentioned several. I talked about metformin, which is probably one of our oldest medications. Metformin is given once or twice a day, and it helps your body to use the insulin that you're still producing as a diabetic better, or if you're on insulin, it helps that insulin work better in your body to control your blood sugars. Side effects from metformin generally are GI, nausea, upset stomach, and that does keep some people from being able to use it or certainly use it at max doses. But it's a great add-on or first-line drug for diabetes type 2. The sulfonylureas, an older class of drugs, again, very good for bringing your blood sugars down. They help your pancreas make more insulin. But they do have the potential for causing low blood sugars, and so in the elderly patients, they're probably not the best choice for folks that way. We talked about the SGLT2s, a new class of drugs, which are pretty exciting because they work at the kidney level to help increase the amount of sugar that your body excretes through your kidney and thereby bring your blood sugar down. So it doesn't affect the insulin production side of things that way, and so it doesn't cause any potential or further damage to the pancreas in terms of making the beta cells work harder. Also, interestingly, it helps us lose weight. There's been some good studies to show some weight loss with these drugs, so they're a good addition that way. And also, there's a lot of research currently going on and looking at adding the SGLT2s to type 1 diabetics in their insulin therapy to help bring their blood sugars down. The current issue or concern there is diabetic ketoacidosis and some of those folks, which can be life-threatening for type 1s. GLP-1s are a new class of drugs which I think have been very exciting in the results that we're seeing from them. Victoza is one of those medications that's currently on the market. Bydureon, exenatide, Byetta, all those are available, different strengths and different dosing schedules. They're injectable at this time, which makes them a little harder for folks to use, or folks are more resistant, I should say, to using those. But they do a great job at helping curb appetite, causing weight loss, also helping your blood sugars drop by increasing your insulin use and sensitivity. And I think they're going to be a drug that probably, once we get a little more comfortable with them, will probably be a main go-to drug, either as a first line or certainly as a second line addition. You have the DPP-4 inhibitors, sitagliptin and Januvia, which are also another medication that work at helping your body do a better job of controlling blood sugars. They work by increasing the natively produced GLP-1 that we make in our stomachs and intestines last longer, and thereby again doing the same things we talked about with weight loss, appetite reduction, and improving the insulin sensitivity that our bodies have. Insulin obviously is a mainstream drug for folks. We use long-acting insulins, the Lantus and the Detamir, and some of the new ones that are coming out now to kind of provide a 24-hour level of glucose, and then using the shorter-acting Humalog Novolin insulins given with meals to help cover those rises in your blood sugar associated with your meals. What we're trying to do with these, honestly, is just create a artificial functioning of your pancreas like it normally would do in a non-diabetic person, monitoring and dealing with your blood sugars. I think if you if you're concerned or interested in learning a little bit more about this, certainly I would recommend that you look at our website, saresearch.com. If you'd like to come in and get tested for your blood sugar, if you think you're diabetic, or if you know you're a diabetic and just want to see what your blood sugar is, or are interested in coming in and doing some research studies with us, we welcome you to come. Again, you can check our website at saresearch.com, or if you call into our main office number at 210-949-0122, they can set you up for a pre-screen appointment where we bring you in and kind of get a quick history on you, do a finger stick, and then we'll know what's going on. And if there's studies that you're interested in, we'd be happy to get you involved with those. Any questions, we're happy to answer those. If you'll submit them online, and we can get an answer to you. All right. Well, it's been a pleasure talking with you today, and I thank you for the opportunity to meet with you and tell you a little bit about diabetes and what we do. Good health to you.